Welcome to Spotlight Sessions, where we shine
What's
a light
your
on
story?
incredible impact. What does accessibility mean to you?
What's your mission?
Hello, and welcome to another episode of the Spotlight Sessions. My name is Avital, and I'm the host for today, and I'm really excited to be talking to Vic DiGravio, who is the president of Riverside Community Care. How are you today?
I'm well, Avital. How are you?
I'm doing really well. Thank you so much. It's really great to have you here. So why don't we just dive right in? Why don't you tell us a little bit about yourself?
Sure. My name is Vic DiGravio. I'm the president of Riverside Community Care, as you mentioned. I've been with Riverside in this role for about 15 months, but I've worked with Riverside closely in different roles over the past 15 years. So I feel very fortunate to be here and be part of the executive leadership at Riverside.
Yeah, definitely. 15 years, that's quite a feat. I feel like, that's not something that we hear to be typical these days, to be with an organization for so long. Why don't you tell us a little bit about Riverside and what you guys do, the services that you offer?
Sure. Riverside, our mission at Riverside is to make a difference in the lives of the individuals, families, and communities we serve by providing innovative behavioral health and human services, including using technology to meet the needs of the individuals we serve. Annually, we serve approximately 40,000 folks. We have approximately 80 programs and 60 different sites in which we serve those, provide those services.
Mm-hmm. And can you tell us a little bit more about those sites? So where are they located?
Sure. Yeah, so we're based in Dedham, Massachusetts, and we provide services throughout much of eastern Massachusetts, going out to the central part of the state. And the services we provide range from outpatient behavioral health services to in-home therapy services for children and families. We have residential programming for individuals with developmental disabilities and acquired brain injuries. We have more intensive services for individuals struggling with mental health and substance use disorders. So we really serve the range, the lifespan from birth to cradle to death, essentially, in a number of areas.
Yeah, definitely sounds like you guys are doing a lot and really supporting a lot of different communities of people. So that's really amazing. I'd love to hear a little bit about the different roles that you've had. I mean, being at Riverside for over 15 years, that's like I said before, really amazing.
So I've actually, just to be clear, I've been at Riverside for 15 months as president, but I have worked with Riverside in different roles for over 15 years. Prior to joining Riverside, I had been for 12 years the president and CEO of the Association for Behavioral Health Care, which is a statewide association that represents Riverside and 80 other similar organizations in Massachusetts. So during that time of my career, I worked closely with the leadership at Riverside on public policy issues, advocacy issues. And then more recently, I worked for 2 years. I was vice president for strategy for EHANA, which is a health information technology firm. Riverside was one of our clients when I was at EHANA. So even though I'm relatively new to Riverside in terms of working here, I've worked closely with the team for many, many years and really, which is why I was so excited to come to work here, knowing the great work that Riverside does, its history of providing innovative care, and really being a leader in our industry, not just in Massachusetts, but nationally.
Definitely. Thank you so much for clarifying that. So since you've been involved with Riverside for so long, I'm sure you have a really great idea of everything that they've done and everything that you've done while, you've been there and you've been involved. Is there any one specific accomplishment that you're most proud of, either, just over the lifespan of Riverside or even while you've been there?
Sure. And there's a lot we're very proud of, and I'm proud of in terms of Riverside. I think first and foremost is our commitment to serving individuals who traditionally, and families who are on the margins of our society. Folks come to Riverside oftentimes when they have no place else to go. And we're part of the safety net within the Commonwealth of Massachusetts for individuals with mental health issues, for individuals with addiction disorders, for individuals with developmental disabilities. And in the commitment to serving these folks, and not just to serving them in terms of doing the bare minimum, but really providing high quality, innovative services that helps folks live as independently as possible, and with the most dignity possible. That's really what Riverside's all about. And I think the other piece of it is the culture that we've created in terms of our workforce. We have approximately 1,500 employees, and Riverside historically has had a culture that values our workforce, that invests in our workforce, and really we pride ourselves on being an employer in an organization where people want to work here and they want to, even though I've only been here 15 months, it's not uncommon for us to have staff that have been with us 10, 15, 20, in some cases 30 or 35 years. And that speaks to the culture, and it's something we're all very proud of.
Definitely. I mean, the fact that you were involved with Riverside for so long and then decided to come on board and be a part of the organization as well says a lot about the organization itself. And the one thing that's coming to my mind when I was listening to you talk is that the culture of the organization of the company is so important. And just in my past working in service industries and stuff like that, you really learn that when your employees are happy, your clients are happy. And I feel like that's very transferable. The fact that the staff is so happy and really loves the culture of Riverside and everything that you're doing, really translates over to the community and being able to support the community in full capacity. So I think that's really a great lesson to learn, and a great thing to talk to other organizations about. So I this is a question that we typically like to ask everybody,
Sure.
because we always get very different answers, depending on the type of organization or even the person that we're speaking to within the organization. But what does accessibility mean to you?
So accessibility, again, for the population we serve, it means allowing individuals to live as independently as possible in the communities in which they were born and raised or where they choose to live, right? So it could
Right.
be accessibility to employment, accessibility to housing, in healthcare, something as basic as healthcare. A lot of folks with mental health and addiction disorders, really, in terms of historically, have experienced a lot of stigma and being totally honest, a lot of discrimination even within the healthcare system.
Definitely. Yeah.
There's and there are folks in some ways that need access to healthcare more than anybody. There's research that shows that individuals with mental health disorders on average live 25 years less than the general population. And that's a reflection of the historic discrimination that they face. So access to quality healthcare, and that's why what we do is so critical. And again, it depends on the population. For our folks with developmental disabilities, access to employment. People with disabilities, the unemployment rate for people with disabilities is, I think, 60 or 65%. And folks with IDD and acquired brain injuries are a big piece of that. So for somebody to go out and be able to get a job and maintain a job, and help support themselves, that's a huge part of being able to live with dignity and independence. So we really, at Riverside, we think of accessibility in the broadest terms possible, understanding that depending on the individual we're serving and what their living conditions are, it may mean different things for them than somebody we're serving in another one of our programs.
Yeah, that's amazing. I've actually, in my time here at accessiBe, and doing these interviews, I haven't had somebody who phrased it that way, and looking at the population and looking at accessibility through the lens of the population that you're working with. So, thank you so much for that. And if you had one message to the business community, what would that be?
So just one message. I have so many messages.
or
Uh,
or a few. You could definitely give
well,
us a few.
I think first of all that the ability for people to live as independently as possible is essentially, it's a civil rights issue, right? It's something that we all, and a human rights issue, that despite whatever conditions we're living with or struggles we all have the right to live as independently as possible. And I think the other piece of it, and this is especially true in our work in behavioral health care and mental health and addiction services, is that the cost of not treating these conditions is exorbitant in terms of increased healthcare costs. There's clear research that shows that if somebody has a co-occurring physical health issue and a behavioral health issue, say asthma and drug addiction, the cost of treating that individual's asthma is 2 to 3 times higher than somebody with just asthma alone. So
Wow.
it's far more cost effective to treat these conditions up front, both in terms of managing healthcare costs, but also costs of to society of lost worker productivity, criminal justice costs. So we really like to talk a lot when we're advocating for services, is that the investment we make up front in treating mental health and addiction disorder is going to pay itself back many, many times over in the years moving forward. So that to us is a really key message.
Definitely. And then my last question is, if somebody wants to get involved with Riverside, how can they do so?
Sure. So our website is www.riversidecc.org. There's lots of information about Riverside on our website. We're also on Twitter and LinkedIn and Facebook. So if you just search Riverside Community Care, we're always looking for staff. We're constantly hiring. We're also looking for folks to support us in terms of fundraising and charitable giving, and depending on the programs, volunteering. So yeah, I think our website is a great place to start, and then our social media platforms.
Amazing. Well, we'll definitely have all of that in the show notes,
Wonderful.
or in the description notes, I should say. But Vic, thank you so much for taking the time to, be on the spotlight sessions with us today. It really was a pleasure to speak with you and learn more about Riverside and all of the amazing work that you're doing. And I look forward to our next conversation.
Thanks so much, Avatal. We really appreciate you reaching out to us, and our partnership with accessiBe is very exciting for us. So thank you.
Of course, it's our pleasure.
Take care.